What's up?
Welcome.
Welcome to the Freitas Effect.
Yes.
My name is Azeb Freitas. I am one of your co-hosts.
And my name is Simon Freitas.
Wow, welcome.
Co-host.
So, I'm going to get out of this
The
because I can't do that forever.
Effect. All right.
Welcome to the Freitas Effect.
Yes.
We out here, we back. It's another week. We made it.
It be.
It's great. So this week's topic is going to be about healthcare, health insurance, politics. Who's running for president? Why are they running for president?
Yeah.
Just kidding.
Wait.
We don't know. But stuff related to that topic. So we hope you enjoy this.
Yeah.
The reason why this came up was because obviously it's about that damn time where we try to get the Cheeto out of the circus.
Bye.
And we get a new clown, you know? So, in case you didn't understand that analogy, it is election season, therefore campaign season.
Yeah.
Therefore, all the annoying advertisements came back, and we got to pick another leader.
We got to do this.
So,
again.
also, Simon and I have entered the real world where health insurance is a thing.
We're here.
And it's really important. And now we feel like other people our age are starting to get kicked off of their parents' health insurance
Yup.
and are trying to figure out how to navigate the U.S. healthcare system or any other global healthcare system situation. So before we go into that, we're gonna talk about what our political stances are, just to give you some perspective and context of where our experiences are coming from and whatnot. So Simon, do you want to go first?
Yeah. So honestly, I'm the kind of person that says Democrat when they ask what's your political party affiliation, just so I can go fucking vote in the primary, because it's just that's the one I'd rather have my bid into. But I don't know. There's a lot of views of Democrats that, once you say you are one, then everyone aligns you with that. And so it's I'm definitely a bit more moderate. There are some extremities of the views that I do coincide with, or whatever the right way of saying that is. But yeah, it's just, there are points, but it's not everything. So
Yeah.
How about you?
Yeah, I feel you. I guess I really considered myself a democratic socialist when Bernie first ran. Because obviously, all the presidential elections I've ever seen started with Bill Clinton in 1994, which is when I was born. So obviously I didn't get to participate in that, and I had no idea what politics were because I was a little infant, you know?
Baby.
Yeah. But then when Obama ran for the second time, I got to vote. So that's when I was okay, I guess I should have an opinion.
I didn't get to vote.
Yeah. So I guess, but I wasn't passionate about I'm a Democrat, because I still didn't even really know what that meant.
Yeah.
And I'm not saying I'm Republican because I'm not,
No.
but I would definitely say I'm more of a maybe moderate left, I guess.
Yeah.
Not all the way left. I don't know what would be holding me back from being all the way left. Maybe other people would consider me all the way left and super progressive and radical, but I don't know. I feel there are some parts of me that are kind of conservative because
Exactly.
I don't support everything the Democrats do blindly and just go, the Democrats did this. Yes.
Yeah.
You know what I mean? I like to be skeptical
I mean,
about
you're your own fucking person.
yeah, exactly. I like to question things, I'm not just blindly yeah, whatever the Democrats say, that's it,
Yeah,
So yeah.
definitely.
So yeah.
Yeah. So
I mean, before we get into that, I was going to ask why do you feel like you vote that way or for that party? You feel me?
I just feel there's a stereotype of the Republican that I just have in my mind, and I don't think I can really support someone that fits that, as blunt and honest as I'm going to be. It's that's just how I see it when I go to vote. It's just this person is very much against a lot of what I stand for. It's they're usually anti-gay. They're usually anti-immigrant, or it's just, there's just so much that comes along with it. And especially given our current leader that is a Republican, that just, it's not so bueno. Yeah, I would just say I lean more to the left because I feel it's safer for me. And I don't feel scared when someone's talking about like a Democrat going in and doing radical things. But a lot of things that I hear with Republicans wanting to do is like detaining people and like just I don't feel comfortable with a lot of it. So yeah, that's why I'd say I would lean more to the left.
Yeah. I mean, I feel like, I don't know, there's always those people who are like, I'm not saying that all Republicans are the devil. You know what I mean? Like, I'm not saying that at all. People have the right to think whatever they want to think. But at the end of the day, for the most part, whenever there is like, oh, the Republican Party wants to do this, nobody's really ever excited about it. Everybody's always kind of like, oh, one of my rights are about to be taken away. You know what I mean? Like Planned Parenthood and like getting access to birth control. Yeah. And it's like, those are also fundamental things that are part of that party that are obviously religiously motivated. Yep. Specifically Christian. That are, you know, take away from the quote unquote way that Americans are supposed to be able to live freedom from religion, but also like to live freely, right? Yeah. And to make your own decisions about your body. It doesn't really make sense. Well, also, like, that's just one example, but there are so many things. There are also other parties that exist, like the Green Party and, was that right? The Green Party? Like the Tea Party?
I think
Are they the same thing? I don't know. There are things I don't know. And then, like, the Libertarians.
Yeah. Ron Swanson.
Yeah. But yeah, so I guess I would say I vote more towards the Democrat side most of the time because of the same reasons. Like, normally my day-to-day life is not threatened if I choose to like vote Democrat. Yeah. That's pretty much it, especially as a woman of color. Yeah. Yeah. And someone who comes from a lower class family. Yep. Like, for the most part, I benefit from the programs that happen.
Yeah, because nobody's been benefiting from trickle-down economics. But anyways.
No, really. Anyways, let's get into the next segment.
Yeah. So, on this episode of How the Turns Have Tabled, this story is about when I was dealing with a whole job debacle with my health insurance. Yes. And so, I got interviewed, and then I got hired 2 days later for this position as a temporary human resources assistant in Dot House Health. It was awesome. It was a great job. Temp work is always the shit because, you know, you're always seeing the fucking door. But the reason why I couldn't start was because I didn't have... My health insurance was wonky, and I needed to get immunizations, and it was just rough because I didn't know that my immunizations weren't like, I didn't have them on file, and I'd switched from, you know, the Boston Children's Hospital to like an adolescent facility, and then I went to UNH, and so like all these files are getting sent everywhere, and so then finally when I'm applying to a job in a health facility, you know, you need to be up to date for your immunizations. They were just like, oh, well, if you can't have them in by this day, then you can't start, and I'm just like getting worried that I'm about to lose this job, and I was unemployed for 2 months before I had this job, so it was, you know, fucking silver lining that I was getting hired like immediately and they wanted to get me started. Right. But it was just that situation of like, it was a bad management of files, like, you know, shifting around. And eventually I went in and then I got my blood tested and they said I didn't have the immunizations that I needed to start. And then they wanted me to go to just a random ER facility or like emergency care, urgent care, to get the immunizations. And I was just like, okay, cool. So how much is that going to be? They were like, oh, probably not too much. And it's like $275 for the shots. And I'm like, each? They're like, yep.
And
I'm
you're
like,
broke. Like, you don't even have a job.
Exactly. I haven't started the job. Sense. Yep. So I can't pay for the immunizations to start a job. Like, it's just catch-22 shit. So then eventually my health insurance stuff gets like figured out where I just said, fuck it, I'm gonna bite the bullet. I'm gonna just pay $500 for a fucking visit when I thought I was insured from UNH. Then I went in and I got my fucking shots done. And then they said that I could like, I don't know, sign a waiver and then like, you know, just get started even though I didn't finish the whole like Hep B cycle because that has to be like 3 shots over the course of 6 months. Jesus. Yeah. So it was just so
they would have made you wait 6 months to start a temp job.
Yeah. But they needed me immediately. Like, even when I was talking with them when I started, they told me that they almost cut me. Like, you know, they almost just were like, yeah, you're taking too long. Like, we can't have you. But I got it in right in the nick of time, right before the person came back from vacation or whatever, sick leave.
Yeah.
Yeah. But it was rough. And that was just because, like, as we've been saying, like, the American healthcare system is not perfect. Like,
it ain't. It's
very fucking flawed. Yeah.
It ain't it.
Yeah. It was a lot.
Anyways, yes.
Yee.
And there's more. How did the turns table?
Okay, so the way that the turns have tabled is that was a fucking temp job. And then my real job, I get interviewed, I get second interview, I start, no one has asked me about immunizations. And I'm like...
But do you think it's because you worked at a place that was literally all about health insurance?
Yeah.
So they had to be tighter about it?
I was in HR. Like, you know, it's like it was like connected to a health facility. So I do understand being around that stuff. But it's still just like, if my real ass job that gives me health insurance isn't asking me.
Well, that's probably why they're not asking you, because they're going to give it to you.
Yeah, but like they're not asking me about my immunizations. Like they didn't have to get that stuff cleared.
Maybe their priorities are significantly lower in terms of their own safety for their health.
They're trying to get sick.
Trying to get sick.
Let's get sick, guys.
Oh,
all right.
Okay.
So that was how the turns tabled.
Awesome. All right, so we're gonna bring y'all into ribbits.
Ribbits. Yeah.
Which we're still trying to figure out what we're actually naming this segment, but we have like two that are coming back and forth.
Yes.
So obviously we have random people in the street, which we have not encountered any random people in the street yet because we have so many wonderful people in our lives. Simon's holding something back right now. What do you need to do?
Random people in the streets. I was wound up for so fucking long.
He was holding that for so long. I don't know if you're ready for this one. And so there will be a day that we actually do interview people in the street, but we just haven't been doing it because we have friends in our lives and people that we know that are just so wonderful
for now
and are experts and smart. And so we call it Real People in the System for now until we don't like it anymore. So I'm going to introduce two folks who are going to give us some more insight about the political game right now, what people are promising in the election. This will come from my dear colleague, David Chy. He and I work together. We're really good friends. He is a graduate of Brown University with a degree in political science, a Rhode Island native, and will be speaking with us about how healthcare is related in this presidential election. And also, we will be interviewing, I solo interviewed my other dear friend, Njideka Ofoleta, who I also work with, that is a graduate of Hamilton College with a degree in communication and Latin American studies. She is about to start a master's program at the Sanford School at Duke in program policy with a focus in healthcare policy and management. She is originally from Miami, and we'll be speaking about the healthcare system to give us the Public Health 101.
The way you say that, like, she is originally from Miami.
I know,
she likes
like I was presenting
long
like
walks
a
on the beach. And if you like pina coladas and getting caught in the rain, then she is your idea. If you like pina... Okay, cool.
Yeah.
But
or weighing it at 110 pounds in the right corner.
Monday.
Anyways.
Jenica!
So, here are their interviews. Before I actually ask you questions about the things, just want to know how you identify, how you would introduce yourself, because people obviously don't know who you are, but just as a person, where you're from, what's your background, anything that you think is relevant, pronouns, etc. David, how about you go first?
Sure. So my name's David Chy. I'm a native of Providence, Rhode Island, currently living in Massachusetts. I'm a Cambodian American, and I go by he, him, his.
Awesome. And you, NJ?
Hello, Njideka Ofoleta here. Nigerian American, daughter of immigrants. I identify as she, her, hers. Those are my pronouns. Originally from Miami, Florida, and also currently living in Boston and headed to Durham, North Carolina.
Yay! Sweet. Okay. So because of the context of our conversation is going to be related to politics, I thought it would be good if we gave people some context of what your political party that you're affiliated with, or that you I guess choose to vote with, so that people know what to where it's coming from. Yeah.
Democrat.
Also, I'm a Democrat.
Okay, cool. So another question for the both of you, since our topic today is related to healthcare. Did you have health insurance growing up? And do you have health insurance now?
Yeah, so as far as I know, I had health insurance from the day I was born. My mom, for as long as I can remember, has worked for the state of Rhode Island, which, like most state employers, offers its employees healthcare coverage, as well as with many private employers. State healthcare coverage is pretty good in Rhode Island, and through the state of Rhode Island. It happens to be United Healthcare. It's one of the larger and more comprehensive plans, at least in New England, if not the nation. And up through a few weeks ago, when I turned 26, I was covered under that. And I'm covered under my private employer's health plan with Blue Cross Blue Shield.
Cool. How about you, NJ?
Yeah. So growing up, I also had healthcare. So my mom worked for the public healthcare system. She was a nurse, so I was insured under her. She covered my whole family pretty much, including my dad, because my dad worked for a private pharmacy, and purchasing healthcare from them was having them subsidize his healthcare was more expensive. So she covered our family. And then in college, she also covered my healthcare as well. And then since I graduated, I've been covered by various employers.
Sweet. So do you guys have any kind of stance on universal health care, or any kind of opinions that you want to share related to that topic, David?
Yeah, so I think that in the discussion today, there's a lot of different opinions and discussion about different phrases: universal healthcare, Medicare for all, etc. Where I stand is that I need to learn much more on the topic before I can really make an informed decision. But I can say generally what I hope to see, hopefully in the near future, if not eventually, is expanded healthcare coverage, quality healthcare coverage that covers all people in the United States at low cost to them or at no cost at all. Exactly what policy proposal or plan gets us there is not something that is within my purview, but that's the operating goal that I'd like to see our elected officials working toward.
Sweet. How about you, NJ?
Yeah, so universal healthcare, I honestly think it looks very different, and I'm very interested to see what model would be the best for the United States. Similar to David, I do hope to eventually see a healthcare system where everyone has access to healthcare, quality healthcare, and less privatized, access to also pharmaceuticals, medicine they need, at a much lower cost. Yeah, I think at this moment in time, privatization has made it difficult for people to access what they need at an affordable amount. And I think that if we move towards a system, hopefully also if we move towards a universal healthcare system, we'll also move towards a more heavily subsidized education system, because I think the two go hand in hand. The reason why healthcare costs are so high is because we have to make a profit, right? And so because we have to make a profit, because education costs are so high, people are paying off debts. It's not profitable to have a healthcare system where costs are low, and so where profit is low. So yeah, I feel like it's all systemic, and all these things go hand in hand. So I think moving slowly towards universal healthcare, universal access to education, that sort of thing, I think is where I would like to see us going. But that's also a much more liberal model than I think we're ready for right now.
Great. Well, thank you guys both so much for those wonderful answers. You're both so incredibly intelligent. Cool. So then I guess I'm going to kind of gear these questions to David, because I'm about to start asking about what's going on in the presidential candidate election for 2020. So, David, would you care to share, like, what's going on out there? What are these people saying? Who's even running? What do we need to know? What should we be concerned about? If you know what's going on both sides, or like whatever all of the parties are. And yeah, since you're our political expert for today.
Sure. I don't know if I know or if anything that's going on. I'm not sure if the candidates know what's going on. It's a lot of craziness out there. I mean, I think 20-something people are in the race right now, at least on the Democratic side. So it's really hard to keep track of where everyone stands specifically on the issues. But maybe it's easy to give an overview and break down the different competing viewpoints that are out there. So on the Democratic side of the equation, I think it boils down to maybe three broad categories. One is the Medicare for all / universal health care system that many candidates have been talking about. And I think, as Njideka mentioned earlier, that's one in which at least one version of it would eliminate private health insurance throughout the United States and establish the United States government through some center, agency, or organization as the sole provider of health insurance to Americans. The model under which that would be funded is, largely likely through payments by Americans, and then distributions from the fund would be going to those that are sick. So that's the policy proposal that is supported by those more on the left, the more progressive wing of the Democratic Party. So, for instance, it would be candidates like Bernie Sanders, like Elizabeth Warren. Others that have supported it include, or announced their support of that, include Senator Kirsten Gillibrand from New York, and a number of other candidates as well. Straying slightly away from that model, there are people who are proposing some sort of hybrid, either lowering the age where people would be required in order to get Medicare, or covering different ailments, different conditions, covering different populations other than the ones that are currently defined. So, the elderly, certain young populations, in low-income populations, et cetera, or lowering the income threshold by which people would, need to meet in order to qualify for Medicare, Medicaid. And, some candidates who have spoken along those lines are Mayor Pete Buttigieg, Senator Cory Booker.
Is that how you say his last name?
It's unclear.
Okay.
It's unclear.
Okay.
So we'll just go by Mayor Pete.
Okay.
Yeah, South Bend, Indiana. It's like some.
I really don't know anything, so I'm learning everything right now.
Well, honestly, I think some of the candidates are learning what their viewpoints are as they, talk during the debates, honestly. But who knows? But yeah, no, that's like along the quote unquote more moderate positions that some have espoused. And then, it gets even closer toward an ideological center when people are talking about other hybrids that also expand Medicare, Medicaid, but maintain our system of private health insurance by which the majority of Americans in the United States continue to get health care. And those might, for instance, be former Vice President Joe Biden, who, of course, as Vice President with Barack Obama, helped push forward the ACA, Affordable Care Act, or Obamacare, which vastly expanded insurance coverage to a greater number of Americans, but maintains our system of private health insurance.
So do we know anything about what's going on in Republican land, or no? Because if we don't, that's okay. I'm just curious.
That's a very, very dark place.
We don't have to go there.
Yeah. No, I think it's even more chaotic than Democratic land. I don't really know if they know where they're all at in terms of what they want. As far as presidential candidates go, if I am recalling correctly, there are 2 declared ones in the race. We have the current commander-in-chief in D.C., that guy. Yep, him.
Does he have a name? Oh, that guy.
Yeah.
I forgot.
Yeah.
Whatever. So that guy.
He's at various points talked about. He's talked about different things that he's wanted to do on the campaign trail. In his first campaign, he talked about striking down Obamacare, but keeping certain popular provisions like coverage for folks until the age of 26 or protections against patients with pre-existing conditions. These are 2 provisions of Obamacare that are popular pretty much across the aisle in particular. I should say across the aisle with voters, if not so with the politicians themselves. Right. But during his administration, he's kind of changed tack a little bit. He's really moved aggressively to attack Obamacare, including different parts of it that are popular with voters, such as, for instance, coverage for pre-existing conditions. He's gone back and forth on that. Mm-hmm. Hard to say where he really stands. The only other candidate that I think has officially declared for the Republican side of the race is former Massachusetts Governor Bill Weld, who ran as a libertarian with Gary Johnson in 2016. And unfortunately, he hasn't made too many waves or splashes in this race just yet. I think the focus has been on the Democratic side, so it's hard. I'm not too fully informed on where he stands on the issues.
Okay. But you say that he was a libertarian and now he's claiming Republican?
That's correct. So as governor of Massachusetts, if I remember correctly, he was a Republican governor. I think he was a much more liberal Republican than many other Republicans are today, probably par for the course being from Massachusetts. And he, approaching 2016, concluded that he identified more as a libertarian than as a true Republican in the sense of that word today and where the party stands. But perhaps he's now looking at 2020 and sees that a libertarian ticket is just not feasible. He's been there, he's done that, and it didn't really work out, obviously. And I guess he's changing tack and thinking different in terms of strategy and how he could maybe, at the very least, put his name out there and spread a different message in the Republican Party.
Great. Well, thank you so much, David. Really appreciate that. I've learned a lot. I hope that you all too. I'm going to switch over to Njideka to talk more about all of the fascinating things in the public health world, since that's what you're going to pursue, some more stuff about policy management and whatnot. I personally am kind of curious, the switch up from undergrad to this of what is inspiring you to go into policy in regards to healthcare. So if you wouldn't mind sharing, yeah.
Yeah, sure. I can share. So as Azeb mentioned, in undergrad, I majored in communications and Latin American studies. I've always been interested in international development work. Some context as well as to my interest in healthcare. I come from a family of healthcare professionals. My mom's a nurse, my dad's a pharmacist, all my aunts are either nurses, NPs, all my uncles are pretty much all pharmacists or nurses. So healthcare is pretty important in my family. Not only that, but a lot of my family has struggled with chronic diseases, such as high blood pressure, strokes, heart disease runs in my family as well. So having access to healthcare is important. My grandmother on my dad's side passed away in Nigeria from a stroke from what I'm pretty sure was pretty preventable, preventable disease. My mom on my mom's side, she had a stroke in 2003. And thankfully, because my mom had the knowledge and access, also she was lucky enough to be a citizen, she could travel back and forth without any issue. She went to Nigeria, got my grandma, brought her back to the United States, and she was able to receive the healthcare she needed to keep her alive. And in other circumstances, she probably would have passed away, but she's still alive till this day. And so thinking about that, a lot of people don't have that privilege, don't have the privilege to have someone in their family who's knowledgeable about healthcare. be the access to cross borders like that easily, and see the resources, both in the United States and internationally as well. So why I'm switching to public health, public policy, and like global health policy, is because I want to help provide access and change healthcare systems internationally, specifically in Nigeria because it kind of sucks there, and specifically focusing on like maternal and child health because I think, well, obviously, like mothers and children are like the most vulnerable, and so, yeah, that's kind of why I've made that switch and transition.
Love it. Great. Okay, so my next question is if you could provide some kind of a like healthcare system in America for dummies or like some kind of public health 101, just like what's going on over here comparatively, if you know what's going on in other countries, like what their systems are. So sorry if that's like a super loaded question, but like if you could share, that would be great.
I'll try my best to talk about it with my limited knowledge. I still have a lot to learn. But from what I do know, the U.S., I took some notes, so I'm going to shuffle through them. The U.S. operates on a single-payer system, well, the mix between a single-payer system and a privatized insurance system. And for those who don't know, a single-payer system is pretty much when one entity pays for healthcare, while hospitals, clinics, and other healthcare institutions are run by separate organizations who employ their own providers. So the part of the United States healthcare system, which is more along the privatized insurance side, is, for example, how all of us are insured by our employer. And we pay premium, and the rest is subsidized by our employer, our place of employment. So that's the privatized insurance model. And the other side of the U.S. healthcare system is the single payer model, and that's more similar to like Medicare and Medicaid. Medicaid is a public assistance program for low-income folks, provides healthcare, subsidized healthcare for people who don't have access. Medicaid, as you all know, is for people who are 65 years and older, and it comes out of like Social Security and that sort of thing. So both are paid by taxes and by the U.S. government. Yeah. So that's like a little bit of an overview of like the healthcare system and like a little bit of how it works. Let's see, what else? So I guess thinking about healthcare, how healthcare works in other places. So we've talked about the universal healthcare system or whatnot, right? So universal healthcare is like kind of like an umbrella term. The one payer system falls underneath that because in different countries, it's been adopted in the sense that the government will pay for health insurance for all its citizens. A lot of people don't receive bills. For example, in the UK, they run their healthcare system under something called the beverage system. And so providers work for the government. No one gets a bill, and the government controls and sets the prices for what pharmaceutical companies and doctors can charge, which, as I mentioned before, I think it's a better model because prices aren't as high. People can purchase what they need, and people don't have to pay out of pocket for a lot of things. Another model is the Bismarck model. It's mainly employed in Germany, and it's healthcare through insurance, except insurance isn't privatized as it is in the United States. Everyone's covered no matter what. Third model is the national health insurance model, and it's used in a lot of Asian countries. So healthcare is paid through higher taxation, so people pay higher taxes, but they can choose where they want to receive their medical care and that sort of thing. And the last model, the model that's primarily used in the United States, is the private insurance model, as I spoke about before. And so that's compared to model like the socialized healthcare system model, which, for example, is used in Cuba, where all healthcare, so basically all healthcare is owned and run by the government, and all healthcare employers are also are employed by the government. But when you think about it in that sense, also healthcare, education is subsidized by the government as well. So people are trained as doctors, right? In Cuba, their education is covered, and they go to work for the government as physicians. So they don't have debt, so they don't need to be paid higher wages. Well, I don't want to say they don't need to be paid higher wages, but there's less of an incentive to compete for high wages because they're not drowning in debt. You know what I mean? Whereas in the United States, like, people go to med school, and also I want to talk about preventative healthcare and that sort of thing. So preventative healthcare is really important. I think it's the basis for preventing all sorts of chronic diseases. You get checked up, like every year. And your doctor lets you know how to, like, improve your healthcare, what you need to do to take care of yourself. The problem is that a lot of Americans, because they have to pay for healthcare or because they don't have access to healthcare, they're not going to get their yearly checkups. And so they don't address the disease until it's too late. And so if we were to operate back to, like, the doctor conversation. So because people are, like, going to school and they're leaving in vast amounts of debt, they leave med school, and they've chosen to specialize in something else that's not preventive healthcare. That's not primary healthcare, sorry. And so we now have a shortage of primary, like, healthcare physicians because there's not a lot of money in that specialty. So I don't know. It is very real. Yeah. It's a problem. It's a big problem. So I think that, like, in terms of, like, what I think would be the best model, I don't know if I can make that call or say what I think the best model would be. I think it would be somewhere between a socialized model and a one-payer system model, maybe similar to, like, what's going on in Canada. I think the only thing is that I think the critique of, like, the Canadian system, the Canadian one-payer model system, is that, like, because the government subsidizes everything, and there's, like, yes, there's low cost for healthcare and that sort of thing. There's less incentive for innovation, less incentive for, like, the use of, like, more advanced medical technology, longer waits, and that sort of thing. So yeah, I just think there's pros and cons to both. Pros to having, like, a privatized insurance system where competition is encouraged. I think there are also, like, cons to it as well. I think there are many pros to having, like, a heavily subsidized education and healthcare system. I think we just have to play around and see what works best for us. I do think that Costa Rica is doing some cool stuff in regards to healthcare. So I don't know, maybe we should adopt their model as well. But yeah.
Sweet. Well, I feel like I know everything I need to know, honestly. Thank you both so much for taking time to be on my show. And yeah, that's pretty much it. Anything else to add? Any last words?
No.
Make sure you register to vote.
Amen. Amen. You heard the man. All right. Peace. All right. So, Simon, what do you think? Because obviously you weren't there for this interview, so I'd like to, like, know what your thoughts were.
Yeah, I mean, they just broke everything down, like, so much that, you know, I don't really have too much to say about it, because I feel like they are both really, like, well versed and aware of you know, what's going on.
Smart friends.
Yeah, I mean, yeah, they're really smart. Like, you know, I feel like since they're passionate about what they were talking about, then they just have all the facts to back themselves up. Mm-hmm. And even they were aware of, like, what they don't know, and they spoke on that. But one thing that I definitely picked out from that I didn't fully understand was the single payer system. So, like, that meaning the government pays. I thought it meant, like, you pay. Like,
yeah, I thought that's what that meant too.
Yeah, but he said that, like, it's the government paying. So it's them paying for it. So I imagine that's what it would be like. Taxes get raised and then, like, that whole situation.
Yeah, I think that's what he said, yeah.
So that's why I can understand people scrutinizing Bernie so much with like Medicare for all, because if the whole government's just paying for it and no one else is, and even though your taxes are being raised, like, you know, quote unquote like how much, but you know, we'll get into that. But it helped clarify that for me.
Yeah, no, same. They literally like I said, even in the interview, I was like, y'all, I really know nothing about this topic, and y'all, this is, you know, what you studied. You know? Also, just things that you obviously care about, and like it's really cool to like just learn things. You know, I love learning, nerd.
Crazy.
All right, cool. So that easily transitions us into our main topic, the healthcare system. Yeah, I don't know why I'm in this like R&B mood where I just body roll and snap every like 4 minutes every time we introduce a segment.
I'm feeling it.
Hello. All right, so we got some questions. Simon did some research. We got some things to share with
say some stuff.
y'all. So some questions that we were like writing when we were like thinking about this episode was like, how often did you go to the doctors when you were growing up? Was it affordable? Was it an option? Was it a priority? And like, Simon, how do you feel about that?
Honestly, I was terrified of the doctors growing up.
Yeah.
You know about my toe situation. So
The world doesn't.
So the world, get ready. So I had some fucking gross toes growing up. The situation was, I am a large person and I have size 15 fucking feet, and so my feet outgrew shoes wicked fast, but my parents did not have enough money to keep buying a shit ton more shoes that fit my feet comfortably. And so my feet, also I would just like really not take good care of my nails, and so I got like ingrown toenails. I got really, really bad, and then I had surgery like a bunch of times. It was super fucking painful and traumatic. And so I am a little traumatized to go to the fucking doctor because I'm always scared they're going to see my toes and be like, we need to do this surgery right fucking now. Because that's what they used to do when I was a kid.
Oh.
Yeah. But that was like my reasoning for not going. Also, I used to be terrified of needles, but now I have like a few tattoos. So it's like, fuck it. Like pain is pain.
Yeah.
And I'm an adult. How about you?
I mean, I didn't really have to, I wasn't sick all the time, you know what I mean? So I didn't always have to go to the doctor. But I remember like we grew up like going to our checkup and then getting a lollipop, and like those doctors were really fun. But then there was a time where I don't know what happened with our health insurance or healthcare or whatnot, but like we didn't really do our like physical every year, just like because we didn't need to or something. I don't even know. It was like the school just wasn't asking for it, so it wasn't like we had to do it every year. So I felt like it was more driven by school rather than like our parents being like, you have to go check your health. Not like they wouldn't want us to, but I think it was because maybe we didn't have health insurance for something at some point. I don't know. I don't remember. I was a child, so I didn't know.
I remember being able to go to the doctors if I needed to, because you know I also had like a cough growing up, and so like mom and dad would always be worried, and then they would take me, and I was overweight. I had a lot of problems, world.
I mean, same.
Sorry.
Cool.
Yeah, and then they took me to those like lifestyle change classes.
You're just
I went to the
remembering
doctor a lot,
Are you
man.
thinking about this now?
Now that I think about it.
I was thinking about that the other day too. I was like, damn, like I used to go to nutritional classes. I was like, wow, we out here.
No, but I remember.
But it was a good thing. It wasn't like, I mean, whatever.
It wasn't like deep stuff. It was just more like. It was
just kind of like, this is how you should be eating.
Yeah. But.
Yeah.
Yeah, no, I do remember there was like a little bit of a hiatus going to the doctors.
Yeah, right?
Yeah.
Maybe we were just healthy. It's possible.
But
I remember like if I ever had like a broken arm because of you or like some kind of situation where like I had to get my tonsils taken out, like usually we were okay.
Yeah.
Like it wasn't like, oh, I can't go to the hospital because of this, you know?
I'd say we
like
went to the dentist less than the doctor.
Oh yeah, we totally quit the dentist, but that's because we didn't have dental insurance.
Yeah. Because that's way more expensive. Like, I mean, like, it's more expensive in the eyes of, like, well, I could just not give a shit about my teeth. Like, I need to give a shit about being alive.
Right.
Yeah.
But your teeth could lead to those problems.
True.
Which you would not be able to be alive. But, you know, there's obviously other types of health insurance, too, though, like for your glasses. I mean, I don't have any vision.
Oh, like issues. Optical care?
Yeah, that's a thing, right?
Yeah.
Yeah. See, that's another thing, though. That's like a privilege you don't have to worry about if you have good vision. But, yeah, so... I think, like, if it was an emergency, we would be, like, all up in that bitch.
Definitely.
But otherwise, it wasn't, like... I think it's also, like, you know, coming from a lower-class family, parents always have, like, usually having to work, us being in an after-school program or something, it's, like, really hard to make a doctor's appointment for your parent to stop working, to pick you up, to then bring you to the doctors, for them to take time to not be making money so that y'all can survive. It's just this whole cycle of, like... poor people are not meant to like get the care that they need.
Yep.
You know? So yeah, I mean, for example, this goes right into the next question. Like, what was your general experience like when you would get sick? Like, what were your parents' like initial reactions?
Our parents?
Yeah, I mean, just kind of like, what were they like? What was it to you? Because like, you're a dude, I'm a girl. Like, you know, sometimes things are different when like you say you're hurt, or like if I say I'm hurt, or like I'm not feeling well. Like sometimes it's like suck it up, or it's like you'll be okay, just drink water, or like here's some holy water and pray, or like.
It depended what it was. Like if I was like sick with like the flu, then it was usually like mom would have me in her room. I remember like multiple times it would be the summer and I'd have like the flu, and then it'd be like I'd be in mom's AC'd room with like a wet towel over my head, and she'd be like, "Oh, just take care of yourself. If you want to watch something, you can use my TV." Like, blah 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 blah. Yeah.
Or like mom would make like gumbo or bula.
Yeah.
Which honestly, to this day, I still feel like whenever I get sick, like I need to eat that because the spices and stuff. But
yeah,
it just like, you know. Or like when you have like a tummy ache, this is like a common thing that like I remember talking about this in one of my classes in college, Plants and Society, about how like ginger ale, like people always say like drink that because like it helps your stomach, but it really doesn't. It's just like a placebo, just because it has like ginger, but
I remember.
It doesn't.
One of my coworkers actually from Dot House, this temp job, told me about like when you have a hangover, you shouldn't drink like soda or ginger ale because like it has sugar in it. You should drink like seltzer water, because all you're really trying to do is burp to get rid of the gas and like help like release that from your system.
Oh my God.
So when you're drinking sugar, it's not helping you. Wow. Yeah, seltzer water, man.
Learning things
bang,
makes
bang.
you dry. It makes your skin really dry though.
Yeah.
Other like home remedies. I remember there was this one time that like Blanca was making pupusas, and she burned her hand, and then she just went to her fridge and got like a tomato and cut it in half and put it right on her hand, and then she was like, "I'm good." And I was like, "Dude, that looked like it burned." But then she was fine, and I was like, "Word, tomatoes are the new cure."
Magic.
Look at vegetables doing their damn thing. Fruits, I mean, I guess because tomatoes are a fruit, I guess.
Yeah.
But like, you know, they out here healing inside and out.
Magic.
Eat your fruits and vegetables, people.
Nature.
Prevents you from going to the doctor. And brush your teeth. Wash your face. Take a shower. Use deodorant.
Light some
candles. Common sense shit.
Bring your house down.
Don't forget. So anyways, where I was going was like, how do you feel like those behaviors and those things that you did or that were chosen for you carry into your adulthood? Like when you go to work and you don't feel good, like do you feel like, oh, I should go to the doctor, or oh, I should stay home, or I'll just push through this and work?
There's a level.
Oh, you got levels.
There's a line.
Okay, tell
of
me.
Like if I throw up in the morning.
Oh my God. I forgot you do that like a lot. Anyways, nasty.
Because that's me. I don't know what it is. Maybe I have acid reflux or some shit.
Yeah,
I
you
should just
probably
not eat at
do.
night. Yeah, but
figure it out.
Whatever. So like, if I throw up in the morning and then I like want to die, I don't go to work. But if I'm okay afterwards, like usually it'll be right before or during when I take a shower. It's like when I brush my teeth, like just that gag reflex, man.
Yeah.
But if I'm like getting dressed and I feel okay, then I'll go to work. And then if I'm at work and I'm absolutely miserable and I can't think about anything else, then I'll fucking go home. But like, if I can just be like, all right, pain is pain, but I need to get paid.
Facts.
Then yeah. Like right now, I've been pretty sick. Like you might be able to hear me sniffling a bit, but like, when I've been going to work, I don't really want to take a day off since I'm on probation right now, and I don't get actual sick time until, or like it doesn't really count until the 3-month period is over.
Okay.
So even though I do have like all benefits and like paid sick time and like vacation days, personal days, like I can't use it until I accrue it and until I maybe sick days are given to you, but I know like other stuff isn't, and so like until I'm off the probationary time, then I don't want to take any time off work and then have my paycheck be less because I know I'm not getting paid for it. And it's just like, can I just fucking push through it? Like, so that's why I feel like I have the line of like, okay, no, you physically cannot do this. You're going to make everyone else sick.
Yeah.
Stop.
Well, that's funny because for me, I'm the worst, and I'm also a workaholic, and I'm one of those people who, like, when I'm sick, I just can't be in my bed. Like, I have to be doing something because then I'll feel even more sick. Like, if I choose to stay home, I must be like sick, like can't even move sick. Anyways, so yeah, when I am sick, usually I'll be like, okay, is this sick like going to be disruptive in the office? Like, am I coughing a lot? Am I sneezing a lot? Is it going to be all over my cube? Am I going to get other people infected? Is it like within the first 3 days of me being sick? Like, I think of those things. And then I'm like, okay, if I can probably get other people sick, I'm just going to be like, y'all, I'm not coming in.
Yeah.
I'll work from home. Or if I know I can't even like look at a computer, I'm going to be like, I ain't even doing this. But I also have unlimited sick days. So like, I'm lucky.
Oh, that's nice.
Yeah. My job cares about me. And also it's funny because like whenever I go into the office and I'm obviously clearly sick, everybody's always like, Azeb, why are you here? Go home. What are you doing? Get the hell out of here.
Yeah.
And I'm
'cause
always
they
just
don't wanna
like,
get
but I
sick
have
either.
meetings
Yeah.
or like whatever,
Just
you
work
know,
to do.
just like deadlines that are important.
Yeah.
But also like you should choose you and take care of yourself. You feel me?
Yeah.
But who listens to their own advice? Not me. Anywho, there was a point that NJ brought up that of like the reason why she wants to go back into like healthcare management and like to help the system like globally and like back home in Nigeria for her. And it made me think of like all the people I know that are, you know, Ethiopian, or just like people of color in general. Like anyone that I do know that's going into public health is like somebody who's a child of an immigrant. That might be just because we're in Boston and we're like in the medical, like the top medical hub of the US. But like, just like, you know, everybody I know that's studying public health is like, I want to learn this so I can go back to the country where my parents are from.
Yep.
And make the healthcare system better over there because it's significantly worse. For example, in one of the articles you're going to talk about later, it talked about how one of the major findings was the quality of healthcare in the U.S. is not a problem. Like that's what they found. They were like, we know what is not wrong, and it's not the quality. Whereas in other places, you can't even get primary care.
So now getting into the article that Azeb just brought up. So it was a study in the New England Journal of Medicine. All the articles and things that we are referencing, Azeb and I will include in the description of this episode. So if you want to read it all for yourself and, you know, just kind of see what you see, then you could do that. But this article, I found it just a validation of my feelings for the U.S. healthcare system. So it was like U.S. healthcare. They interviewed and received consent to copy medical records of a random sample of adults from 12 metropolitan areas, including Boston. Participants were asked to complete a telephone interview regarding their health history, including a list of all individual or institutional healthcare providers who they'd seen the previous 2 years. So the results were across the board, less than 60% of recommended care is provided to the American public. So acute and chronic conditions, as well as follow-ups and preventative care, which Njideka brought up. So, I mean, there was like some specific conditions, like cataracts got like 78% and up, and then like alcohol dependence got like 10%. Like, you know, there was like some outliers in this, but I thought it was interesting because our experiences were like validated by this data saying that until
Don't you love that?
What?
When there's data that backs up your experience.
Exactly.
So you ain't crazy. Love it. I love it.
It shows like until something's done about this, then like things will continue to fall through the cracks. And I'm happy that this was done by the U.S. healthcare system because it shows like you can't fix yourself like in your system without kind of like taking a step back and like seeing what people inside of it are doing, like are experiencing. And just because something works for a lot of people doesn't mean that, and has been in place for a long time, doesn't mean it's the end all be all solution. Like it's a very privileged mentality that is common among people who like oppose change. So yeah, it's just
literally that could be related to anything.
Yeah.
Everything you just said, all of that, that could be literally related to anything.
Mm-hmm.
Amazing.
So that was all of my feels about that article.
Lovely.
Yeah.
Great. Do you want to just get into the other article?
Do you have anything else you want to say about health insurance?
Yeah.
No. Well, let's get in it. So, the next few articles are about the presidential candidates and their health insurance policies, what they support. So, I just remember when I was listening to the NPR Politics podcast, they were talking about how the presidential candidates, like when they were first announcing their bids, like one big thing was that they were using their healthcare positions to kind of define themselves. And that's been a very big thing since, healthcare and health insurance is a wide, like a view that a lot of people around the U.S. do want to see some kind of change around. Mm-hmm. So one of the things that David said, which was, cohesive with this article?
Yes.
Yeah.
Just say it.
Yeah.
We make up words. We redefine them.
Big words.
We need to read more.
Is Medicare for All is very super popular.
Medicare.
Very super popular. I'm so smart,
Oh my
guys.
God, she's like the blonde cheerleader.
The Democratic
Okay, you better all imagine Regina George every time you think about Medicare now.
Regina George.
Because we've all been personally victimized by Medicare. All right, anyways. Take it away.
But yeah, so you want me to
get it, boy?
me
This
to
was
jump in
your
there?
research. Support.
Awesome.
You're so smart.
You wrote so many different names. So I'll say
I got excited.
Yeah, so I wrote Bernie Sanders. Azeb, what did you write?
I wrote Let It Bernie.
Let It Bernie. Yeah, so he believes in the Medicare for All, Medicare that applies for everyone. CNBC says that Sanders' radical overhaul has virtually no chance of passing the Republican-controlled Senate, and critics claim that a single-payer model could blow up the federal budget by trillions of dollars. Other Democrats like this idea.
Put us on the news.
Yes. Like Elizabeth Warren.
Lizzie.
What's her name?
I just put a heart. That's it. Oh,
you
no.
didn't.
Elizabeth Warren.
Elizabeth Warren, according to I don't even fucking know.
I'm so sorry.
This one is Jacobin Mag. Wow. Elizabeth Warren firmly supported Bernie Sanders' Medicare for All bill during the first Democratic primary debate of 2020. She says, I am with Bernie on Medicare for All. Asked 2 days later if she stood by her answer, she didn't budge. She said, yes, I held my hand up. What part did you not see? Oh!
Honestly, she probably did exactly sound just like that.
Snaps! This bitch fears.
I'm dead. Kill me. Okay.
Fuck. It also says Warren's newly emphasized commitment to Medicare for All is a very positive development, and single-payer advocates should be glad for her support. But we're not going to win Medicare for All without a president who prioritizes it and mobilizes their supporters to fight for it.
Okay.
Next.
I wish y'all could see Simon's arms swinging in the air like he's actually running for president.
I'm having fun.
It's great.
All
Okay,
right. And then
this
we
one's a
got
lot.
Kamala Harris.
It's okay. You said her name wrong. It's first of all, it's KKK Mala Harris.
Kamala.
Woo.
Kamala.
No, you heard.
I know what I did.
Okay. Anyways.
She also supports Medicare for All. And
Yeah.
I think this was from the NBC article. It says Senator Kamala Harris of California has signaled signs. Shit, words are hard. Signaled since around. Hold on, I'm gonna start this over, guys. Senator Kamala Harris of California has signaled since announcing her bid that she wants to end private health insurance. She says, the idea is that everybody gets access to medical care, and you don't have to go through the process of going through an insurance company, having them give you approval, going through the paperwork, and all of the delay that it may require. So I don't fully understand that. Do you?
Nope.
Damn.
You know what that is? That's a political answer. That's being a diplomat and not really saying what you want or what you can say.
America.
That's when you like don't really know what you're saying about health insurance.
Yeah, speak with your chest.
Yeah, girl. I mean, but also like I don't really care because I'm not voting for your ass.
Bye,
Whoops!
Kamala.
All right, next.
All right.
I don't know how to say this guy's name, but
Okay, so I wrote it out.
Oh, I see you.
Yeah. So I was on this thing that was called like Speak with Rachel or some shit like that. And it said it's Pete.
Yes.
You want to read your name first?
No, you go first.
Okay. So it said like from book.
Yes.
Did jidge like fridge at the end, so it's like Buttigieg.
Okay.
Yeah.
That is not what I wrote. I wrote but muncher guy.
Yep. But I guess he goes by Pete. So South Bend, Indiana. Indiana, Zoe.
Okay, now we have to have Zoe on the show because we keep bringing her up.
Yeah, Zoe, watch out. We're gonna drag
Girl,
you.
we
here.
gonna get your ass.
Yes.
Right.
South Bend, Indiana Mayor Pete has also launched. I'm not saying it again. Buttigieg has also launched a 20
like an Ethiopian dish. You know what I mean? Like a lecha. Buttigieg. Anyways.
Has also launched a 2020 exploratory committee and offers yet another route to reforming healthcare, a Medicare for all type proposal that keeps private health insurance providers in the equation.
So his is kind of like Medicare for some?
Yeah, Medicare for most. That's what people have been calling it.
Oh, he's one of those. Okay.
One
of those.
I don't think
I think
he's
David
labeled
actually
it that.
mentions that in his interview. Like when we interviewed David, he actually mentions that.
Yeah. So the simplest way to think about this is if Medicare today includes Medicare supplemental, why wouldn't Medicare for all include a Medicare supplemental for all who want it? So this was something that I was wondering, does that mean like private health insurance?
Yeah.
Like a supplemental? Exactly. So then Njideka, I can't read. Njideka was saying how basically privatization is making things harder to find affordable care.
Facts.
And so this is my worry with the private health insurance being included in Medicare for all. Because I feel like it would create issues with the care given to people and how there could be a variation of the private to public healthcare like facilities, it creates a border where there doesn't need to be one in my personal view, but it also could change the way that the cost works. So I don't know. Maybe it's potential, it could work. Who knows? I don't know. I'm not politics.
We don't know. We're just saying things.
No. So we got Joe Biden.
Joe Biden.
Biden.
No. Biden.
Biden.
Do you even know? Do you even know?
I don't know.
You don't even know.
Azeb, I don't
Y'all,
know.
you got to teach Simon. Get him hip.
Teach me.
You don't even know.
Joe believes, according to AskJoe.com. No, it's called JoeBiden.com. That every American deserves quality, affordable care. Affordable. Does that sound fucking familiar, guys? So we must expand beyond the Affordable Care Act with a public option like Medicare. That's his pretty much a direct quote from JoeBiden.com, which is paid for by Joe Biden for president.
Hey.
So I got another article. I didn't say where the some other articles were, but you'll see it in the fucking link, guys.
Yes.
Got another article. So it says, whether you're covered through your employer or on your own or not, you all should have a choice to be able to buy into a public option for Medicare. Your choice. Biden said, if the insurance company isn't doing right by you, you should have another choice. Biden's proposal is more in line with his more moderate positions and with Pete Buttigieg and similar healthcare plans with both 2020 candidates supporting Medicare for those who choose it. Biden says affordable health care was a huge step forward. The ACA in our country I can't fucking read.
Healthcare is a right, not a privilege.
There we go.
But is it? No, I'm just kidding.
It should be. Is it a privilege? Yay.
No.
Maybe. You decide.
We suck. Okay.
It's so hot in here. It's
Next.
okay. All right.
And it's dark as hell.
Yeah,
it got so
'cause
dark
if
out
we
of
turn the
nowhere.
lights on, it's gonna get so much hotter.
Yeah,
but this is
true.
what we
You're
do
right,
for
you're
you
right, you're
guys.
right.
We're talking about presidents.
We back.
Maybe.
Number
one of
46
these,
coming to you live.
hopefully. So then we got better. I almost read your thought.
I'm troubled.
All right, we got Beto O'Rourke.
It's Beto, but it's really Bet Your Mama
Bet Your Mama.
O'Rourke.
Betty.
Betty Wap.
So from SaltLake.com.
Betty Wap's running for president?
Betty Wap.
Betty Bop?
Betty Boppy.
Betty Boop? All right, anyways, we back. Sorry.
Beep.
So what about
Okay,
him? What about
so-
this guy? What about him?
He believes in Medicare for America. Medicare
Okay, so we
for
got another
America. Huh?
We got another one. He's another Bernie, basically.
We got it all.
Alright,
So
let's
it
do-
offers. Oh, just skip it.
I mean, like, you already kind of said, like, the same thing.
No, it says it offers a ground between standards, which would be more private, and a more modest public insurance option.
Oh.
This bill creates a new revamped version of Medicare that would be open to all adults and children. It would automatically enroll newborns and elders and the uninsured. This would also bar insurance companies from selling policies to individuals that duplicated the government's coverage, meaning it would largely wipe out the non-group market as we know it. However, this part is key. The bill would permit businesses to continue offering private insurance as a benefit so long as it is comprehensive with the comprehensive as today's gold plans.
Cool. I'm down for that. Right?
Companies would
think.
also have the option of purchasing Medicare for their employees by paying a tax. Individual workers could opt for the government plan as well. So I vibe with this because I've worked so fucking hard to find a job that gives me fucking health insurance.
Facts.
And it's Tufts. And it's Tufts health insurance. So it's just like, come on, bitches. Like, don't take this away. But like, maybe if it's time to take it away, take it away.
Yeah.
It's okay. It's fine.
Because, like,
then
some
we can
health
just-
insurance is better than no health insurance.
Facts. Yeah, I just don't want to lose my health insurance.
Yeah.
But like, if I just got to do some work so that everyone can have some, it's not pie.
Yeah.
Yeah. So, and then we got.
And then we got Dump Truck.
Yeah. I don't even wanna
We don't
say
have to say his name.
it. So he says Obamacare is a disaster. It's too expensive by far. Trump told reporters in
okay.
the Oval Office. We're coming up with plans. ... And if the Supreme Court rules that Obamacare is out, we will have a plan that's far better than Obamacare.
Dude, you are missing out on so many opportunities to use a Boston accent right now.
Do you want it?
Please do it.
I could throw it in the future. But yeah, bitch, where? So then Trump. Yeah. Trump had repeatedly called for the replacement of Obamacare during his presidential campaign. In a tweet in October, he said, "We will have much less expensive and much better health care."
Thank you. Everything
Yeah.
sounds better when it's in a Boston accent because we all know Bostonians actually voted for Trump and they're racist. Oh, I said what I said and I ain't taking it back.
Yeah. So after he entered the White House in January 2017,
Let's also pause for a second. He tweeted that
Yes.
and it was able to happen.
Yeah.
Yet, Obama was in office for 8 fucking years and they didn't let him do shit. Let's just let this be a testament
Wait a second. What?
to racism.
What do you mean this was able to happen?
I'm just saying, Trump can tweet and do whatever he wants, and like laws get passed and shit because America hates us.
Yeah.
That's it.
It's nothing new. Just go back to episode 3, guys. So
Facts.
all right.
Rewind.
So back to this bullet.
Yeah.
We're finishing up on T Dumpy.
Humpty Dumpty.
Whatever. After he entered the White House, Trump urged his fellow Republicans to repeal Obamacare, something that they have tried and failed repeatedly to do. Republicans have not been able to agree on a replacement plan. Believing the healthcare issue can help them defeat Trump's re-election bid next year, House Democrats unveiled a new proposal on Tuesday that would expand the Affordable Care Act. Nothing's been fucking happening since he got in there. So fuck you, Trump. Yeah, that's all I gotta say about this bitch. How about you?
Boy, you covered everything I needed.
Wow.
You said it all.
It's crazy.
Yeah, it's crazy.
Oh my gosh.
But yeah, okay, so now that we've gone through everybody who's running, what they stand for, what they're thinking about, what they're trying to sell to us, and what we're buying and what we're not buying. It's honestly, we're not here to tell you who to vote for. We're not here to tell you what to do. We just wanted to bring some awareness into the healthcare system in America currently in 2019, what it's been like, what is proposed for the future, and it's up to you if you want to take action. Make sure that you're registered to vote in all the right places. We'll obviously have another episode where we actually get more into this because we both believe that voting is fucking essential.
Oh, yeah.
So pretty much it's up to you to decide. We just wanted to bring awareness.
Yep.
And we're glad that you stuck it all the way through and listened. We hope you learned something. Simon, do you have any announcements?
No.
No
Because last time I stole your light.
How?
So I'll let you do it. Sharing is caring.
Oh, the ending? Thanks for bringing it back. So,
Wow.
at the end of our episode, we always love to remind y'all where to find us. Follow us on the socials. Follow us at Instagram at The Freitas Effect. Follow us on Twitter at TFE Pod. Find us on Facebook, like our page. You can email us, contact us there at thefreitaseffect@gmail.com. You can also be an incredible human being.
You can.
More than already how amazing you are by listening.
Be better.
You could be a patron. And find us on patreon.com/thefreitaseffect.
So easy.
And please become a subscriber.
50 cents
a
a month?
We'll take any donation.
What?
Because,
Thanks.
like, money important.
Money,
if we want to keep doing this, because this shit expensive.
This is not free, guys. It's rough.
What?
It's not free.
It ain't free.
Nope.
Nothing ain't free. Nobody free. Freedom ain't free.
But we'll do it.
So, anyways, those are the places you can find us. That's how you can donate.
You will go.
All the places we will go.
Vote.
Yeah.
I know we'll get into
just
voting,
watch this stuff,
like
guys.
said.
Like, you can sit and bitch and complain about who's our current president and like whatever, but this is the time to take action.
Yeah.
I've been ignoring the government for the past 4 years, and now I'm back, baby. So like, come on. Like, no, seriously, but I'm back.
Yeah.
Like, this shit's scary. But yeah, we love you and hope that you have a great rest of the week.
Yeah.
Bye.
Bye.
Simon has trust issues. Skirt.